City Council will meet on Thursday, April 9th, 2020 at 7 p.m. remotely to hold a regular meeting discussing any and all business via remote participation in accordance with Chapter 40A of the Massachusetts General Laws in Governor Baker's emergency order dated March 12, 2020, pursuant to Governor Baker's March 12, 2020 order, suspending certain provisions of the open meeting law, General Law 30A-18, and Governor March 15, 2020 order imposing strict limitations on the number of people that may gather in any one place. This meeting of the Salem City Council will be conducted via remote participation to the guests to the greatest extent possible. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technology means. In the event that we are unable to do so on matters not requiring a public hearing, we will post on the City of Salem's website an audio or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. Individuals may participate remotely in the meeting via remote participation platform called Zoom. Members of the public and or parties with the right and or requirement to attend this meeting may access the remote participation meeting through one of the following ways. A link to Zoom, which is on the city's website, and the password if needed. And if you enter this on the Zoom platform, you can join the meeting via Zoom. Or SATV is also airing this, as they do every other Thursday for the last, I can't remember how long, as long as I've been here. So this meeting is live on SATV. April 9th, 2020, City Council regular meeting. The regular meeting of the City Council is being held remotely on Thursday, April 9th, 2020 at 7 p.m. for the purpose of transacting any and all business. Notice of this meeting was posted on April 7th, 2020 at 10:04 a.m. This meeting is being taped and is live on SATV and on the Zoom platform. Currently all councilors are present. Council President McCarthy presided. Councilor Prosnowski moves to dispense with the reading of the record of the previous meeting. All those in favor? All those opposed? I now request everyone please rise to recite the Pledge of Allegiance, led by Councilor Hapworth. I
pledge allegiance
to the flag
of the United States of America
and to the republic for which
which it stands, one nation,
under God, indivisible, with
liberty and justice for all.
Thank you, everyone. Let the record reflect that when any votes that we take via that do not require a roll call vote, require a hand vote, I have everyone up on my screen currently. I can see you all. Great to see you all. For the record, I am in council chambers by myself, and our city clerk is downstairs in her office in case we need. Let the record also reflect that with us this evening is David Greenbaum, our health agent. It's glad to see David at home. I participate in a call with David every day from his office, and he seems like he never gets to get out of there. He's doing a fabulous job. Let the record also reflect that Mayor Driscoll is with us, as well as the Mayor's Chief of Staff, Dominic Pangalo. Public testimony, none. No one signed up in advance for public testimony. So at this point, I will ask for someone to waive the rules to allow the mayor and Mr. Greenbaum to address the city council relative to the COVID situation here. So moved by Councilor Terrio. With that, Mayor Driscoll, David, if you would, please.
Sure. Thanks, members of the council. Wanted to give Dave an opportunity to give us the latest public health update for Salem. I have a couple of slides I will share, just the graphs, Dave, from the information that we have. And I'd also ask Dave to review a new Board of Health regulation that will be taking effect and just go through that. And I have some of those. I'll screen. I think I can share my screen, so I can do that. And as you're reviewing the numbers, Dave, we'll start there.
Yep. So statewide, we're up to 18,941 cases. That's up from yesterday by 2,151 cases. In Essex County, we're at 2,336. That's up from yesterday, 233. In Salem, we have a cumulative case count of 117, and that's an additional 15 from yesterday. So clearly the numbers are going up. I'm happy to see that in Salem anyway, they're kind of staying at that same level of 13 to 15 the last few days in a row. I'm hoping it stays that way. I don't anticipate that, but I'm hoping it stays that way. So that's my one ray of sunshine. You want me to go through the order?
Yeah, let me just, one thing to build off of. I know folks are aware that we did lose our first Salem resident who unfortunately succumbed to COVID earlier this week, a woman who was, I think someone that's probably familiar to anyone who shops at Market Basket. And it's very unfortunate. We are working with the family to put in place a relief fund. I think she touched many people. I think just the story of folks just going to work and doing their job. We obviously don't know how she contracted COVID or what the circumstances were, but we do want to try and support the family. Since that loss, I think we're up to 3 individuals, Salem residents at this point. It's not a number we want to dwell on, and all of these folks are much more than numbers, as we know. But just wanted to point out we are trying to put in place a relief fund for the individual's family, and we'll have more to share with the council and other members of the public at a later time on that. Dave, if you want to go through the new regulations, and they're certainly timely, given I think the fear among many folks working on those front lines, as well as just the need for us to enhance our efforts, knowing that we're still at a peak, we're still seeing numbers rise, and we want to do everything we can to flatten that curve and keep people safe who are working in these essential services or the interactions that are just hard to avoid. I've got the outline here. Can folks see my screen, guys?
Eileen, the city clerk just made you a co-host if you try to send it again.
Geez, I'm so sorry. I thought I was able to share it.
As a co-host, you should be able to.
Let me know when you start to see something. Hang on. I'm trying to get back to where we were. Well, Dave, why don't you go ahead? I'll see if I can pull this up while you're talking through it.
All right. So yeah, in light of what happened with the Market Basket employee, I didn't know her personally, but it sounds like she was really well liked. The mayor reached out to me and thought that it would be a good idea to try and do something a little bit more proactive for the employees in those retail settings that maybe felt some nerves and some apprehension about working every day. So we worked on a Board of Health order that requires any customer and employee in a retail setting, a restaurant that's open for takeout, and in just about every business in Salem, that when they enter that business, they wear a mask. Or, I'm sorry, I'm going to rephrase that. They wear a face covering because we don't want them looking for N95 masks or surgical masks. They're very hard to come by. We're encouraging them to use homemade masks or cloth face coverings, something other than the surgical type masks. The order is also extended to rental properties with more than one unit. So any rental property that has a common area where somebody may have to transverse to exit or enter the property, we're asking those people as well to wear masks, face coverings as they go in and out of the common spaces or any communal space in those buildings. We think it's a good idea at this point that, to help slow the spread, that everybody is beginning to wear those face coverings going forward. This doesn't apply to outside. If I'm correct in that, Mayor, correct me if I'm wrong, but I believe this is really just inside buildings and retail locations. So, it's up on the website now. The press has got a hold of it, so it's out there. And I do think it's timely, as the mayor said.
Are folks seeing the screen now?
Yes.
Yes.
All right, success. So you just went through some of these. Here was the graph. These are available. I'll also point out on our COVID updates on the website. We definitely want people to be aware of not only the number of cases we have, but we're also trying to get information on the number of individuals who have recovered. While we can't share personal data, we would like to better understand the demographics of individuals as well. Right now, obviously, we're pretty busy just spending to everything that we need to on the precautionary side of the house, but we think that's an important piece of data. Just another way to look at the range of cases we had and as when we've gotten them. This is the outline. It is on the website. It's available. Again, essential businesses are more than grocery stores and pharmacies. So if you are an employee in an essential business and you're interacting with the public, and Dave, maybe you could just speak to that a little bit, because when we think of essential businesses now, I think most of us think of those household stores that we're in, but there are still businesses that can operate under the governor's order that may not be something that typically the public is in. Is that accurate?
Yep, so that would include the restaurants, as I mentioned. It would include those businesses that are offering some sort of COVID-19 response. We want those folks to also, when they're working together, be wearing some sort of a face covering. Like I said, we've tried to highlight the places that most people are most familiar with, but the list is not all inclusive. So it's a number of different entities and businesses that would fall under that heading.
We've also got signs that, this is going to be one of those things where we expect and hope that people will follow the order. It's an order, not an advisory or a guideline. It is a requirement if you're entering any of these businesses, both for yourself and for them, anybody working there, anybody else who's in that place, that you that you have a face covering on. So we do have signs that you will likely see printed. These were provided to any of the essential businesses. This one is for anybody, members of the public going in, and this is the sign that can be printed out for residents entering complexes. And we were having some issues with this in some of the housing authority properties, that folks were still in communal spaces, hanging out by mailbox areas, not always practicing good social distancing. And we know we've had certainly some outreach from people who even live in 3-unit buildings and 4-unit buildings who may be immunocompromised, worried about their neighbors, in common areas, and concerned that they're not necessarily exercising, the most protection they can when they're interacting with them, even in those limited instances. So we thought we would also address that. And again, hopefully this is not something that we have to police. We can't be everywhere. That's certainly the expectation, is that folks are going to work with us. And one thing I think it's important to reinforce for anybody who might be following us along at home, we are really seeing a tremendous amount of used gloves, used masks in parking lots, on the side of streets. DPS is reporting, a stark increase in this sort of debris and litter. And we really cannot reinforce enough how inappropriate it is to, put used materials like that, just leaving them in parking lots, leaving them on the side of the road. You don't want somebody else picking it up. It's not only unsafe, you don't want a member of our public services staff to take ill or have to deal with that. That's, really something we hope people can step up. And the fact that we have to remind people of that is sad to me, but these are issues that we're confronting right now, and we really want to reinforce it's not okay to leave gloves or masks or anything like that on the side of the road or, underneath your car when you're in a parking lot. If there are any questions on these orders, I definitely want Dave to be able to answer that, or any of the graphs that we're showing. And now might be a good time to do that, and I'll get out of the screen share. We can.
I do have a question, if I may, Mr. President. Right?
Councilor Dominguez.
Thank you, Mr. President. I had
Councilor Dominguez.
I always have the same question, but I'm little concerned. These documents translated into Spanish, Mayor?
Yep. Go ahead, Dave.
I was just going to say, as you were talking, I thought we need to do that as well. So we will work to get those translated into Spanish.
Okay, my other question, if I may, if I continue, on the testing aspect of what you mentioned, Mayor, do you, by any chance, have the numbers of testing in Salem? Because it's very important for us to know how many people really are testing, and in making sure that the whole population is being addressed. And a follow-up question in that same line is, are we in Salem or we testing someplace else?
Dave, do you have answers on that?
Well, I can say around testing for Salem residents, there is a criteria. They have to meet that criteria. So you have to be referred by a doctor. They have to have a doctor's order, and they have to have symptoms. The test isn't available for everybody. I can tell you that statewide, the state has done 94,958 tests. Yesterday they did 7,447 new tests. Salem residents, they go to the testing facility or the testing site that their doctor sends them to. So they may not be getting tested at Salem Hospital or another site in Salem if there is one. They could be going to any site their doctor deems is where they should go. So testing to me has been a problem, not just locally, but nationally. It's been a problem. So hopefully that'll get better.
I don't believe we get a tally, though, on how many individuals are tested. Is that
No.
that's the question?
No, just the state just says how many they have tested statewide. It's not a breakdown by community as far as I can find.
I have a call today. Someone called me that they want to test, and they sent him to Beverly. For some reason, I don't get it, because here in Salem, eventually we had a one facility here. It's a hospital. They just opened recently. I thought we had the residents here in Salem, so I want to make sure that for me, in order to answer those questions to people who are calling me, I want to know if we testing here in Salem or they sending them someplace else. That's what's on one case.
Yeah, my understanding is that based on the doctor's order, they go where the doctor sends them. We are testing here in Salem, or the hospital is testing in Salem. The health department is not testing. But it all depends on where the doctor's order sends them to. So it may be in Salem and it may be somewhere else.
Council Dominguez, you all set? Next up was Councilor Dibble, and then Councilor Maduro. I see, and then Councilor Hapworth had his hand up too. Is that correct, Ty? Yep. So we'll go Councilor Dibble first.
Thank you, Mr. President. Dave, good job. Kim, good job. Mayor, rather. Dave, could you email each of us counselors the sheet that you just put up there with the yellow highlights so that we can distribute it and post it on our Facebook sites and distribute it by email to all of our constituents?
I'll defer to the mayor. I don't have that. She does.
We can definitely send that to you, but Counselor, I'd also say that it's on salem.com. It's on the website and the latest COVID update. But this PowerPoint does extrapolate out kind of the key details, so happy to share that with everybody.
Councilor Maduro. Are you all set, Councilor Dibble? Councilor Maduro.
Thank you, Mr. President, and thank you, Dave and Mayor, for putting these daily updates together. I'm sure it's no small task, and I find it very, very helpful. I appreciate all the information you're putting out there. And unfortunately, I'm still, at least once a day, I'm still getting inquiries about how many cases we have that are confirmed, what orders are in effect in the city or statewide. And I'm wondering, for constituents who don't have email or access to a computer, how are they getting these daily updates? I think it's life or death type of information to access. So it's important that everyone has access to these daily updates, regardless of how they access it. Can you talk a little bit more about that?
I think it's definitely a challenge given the social distancing and the fact that everyone's doing everything remotely. We are, encouraging people to share them on social media. They're obviously on the website. I'll be doing a call. We've done a couple of Code Red calls. We're trying to not overwhelm people with Code Red calls. The schools are doing calls and we're doing calls. So we want to kind of be mindful of how we're sharing information. But I'll be doing one tomorrow that will include these updates. So hopefully between the verbal communication over the phone, the web updates, and the social media, we're able to connect with some folks. The newspapers and the media have this. We do send this out to any media list, any sort of changes like this, or additional information that we think is important for the public to know with respect to COVID. It is hard to mail something out and have it be timely, and frankly, even getting something out with the limited staff in the building and mailing something out. And I'm not sure that would be as effective either. So if folks have ideas beyond what I've just mentioned, we're certainly open to it. We're asking people in neighborhood associations, we're sharing this with those groups so that all of our individual networks can be used to get information out.
I will say, Mayor, it also goes out on SATV for anyone who's can watch it on cable. So it's on SATV. They do it on their bulletin board daily.
And I would just add, Mayor, that, because this is such a fluid situation and it's changing so rapidly, to do mailings and things like that, by the time they get that information in the mail, it's going to be old information. So really, to get the information out as rapidly as we can, these platforms are the best way to do it.
You still have the floor, Councilman Dole.
Thank you, Mr. President, through you. I think earlier this year we had talked about, in our council retreat, we had talked about something like a 311 number. Is this ringing any bells for you? I think if there's a need to test that service out for residents, or even the state's modeling after the state's 211 number, if they could either text or call to get these daily updates, have the technology to push it out right now?
Yeah, the 311 is it's a little bit more complex integration, so we wouldn't be ready to do that, but there may be an opportunity for sure for us to think about folks can call. If they have the wherewithal or the ability to call and get an update, we can do that. I mean, so we'll give that some thought. That's an excellent suggestion. If we can get that set up, we certainly would. I hate the fact that, if you don't have access to technology, that's definitely right now the primary way we're getting information. But if you're not on the internet, if you're not on social media, if you're not getting our text updates, we do the text updates as well. So anyone who's signed up through Code Red could get a text, could get a phone call, could get an email. You could have signed up for all of those. But folks who may not be technology savvy or have signed up for any of those, but they might be feeling like they're in the dark. We are trying to do as much outreach as we can to older adults, knowing that some older adults might fall into a population of not being as comfortable with technology. But I think the more we can do, the better. So we'll definitely take that suggestion to look at, is there a proactive call or a number that we could set up and give people regular updates if they were willing to call us, as opposed to us calling them. Or if they want to sign up for that, that's, sort of a code. Maybe we could think about doing a Code Red daily update call if folks want that, as opposed to calling everybody, because again, we don't want to overwhelm folks. So thank you for that.
And I would just add, Mayor, that I am in the office every day. As you said, we are on a reduced staffing level, but I do try to get back to people as quickly as I can. So we will answer calls in the office as rapidly as we can and get back to everybody. I'm trying to do it within a day. But as I said, it's been really hectic and we are on reduced staffing levels, but we are trying to get back to everybody as quickly as we can.
You all set, Councilman Dole? Councilor Hapworth and then Councilor Flynn. And Councilor Flynn has learned to use his raise his hand function. I like that.
Thank you, Mr. President. First, I want to just thank you all for everything that you're doing right now. I think that everyone on this call is seeing this through the updates that we get. But for folks watching at home right now or on Zoom, I don't know if it's been pointed out yet, but we have over 500 volunteers signed up throughout the city right now. I think that's an incredible outpouring of support from the community. There's seniors throughout the entire community being called right now. I think that's been super appreciative from the folks that I've spoken to. So I think we all owe a debt of gratitude on that and the way that the city has handled this response right now. Just a couple questions. First, on the mask order that just came out, is this applicable to outdoor lines as well? I know there was some concern at the Willows. Great job supporting local business by the community, but there were lines that formed there last weekend. I think outside of Market Basket and Target, you see some lines at times potentially. And especially as the summer comes out, as people line up if there's ice cream establishments open, is this mask order going to apply to those areas? And then I guess beyond that, is there talk or is there thought about applying a mask order to the entire community when they're outside? I know that there's varying guidance from from the CDC and the WHO are both saying sort of different things around cloth masks. But I know that I've had a number of residents reach out and say, I'm just looking for some guidance about what the city wants from me when I'm out taking my dog for a walk or going for a run. So if you could address those two items, that would be appreciated.
So first, from outside, I don't see this as applying to just being outside, walking around, or going for a run or anything like that. So it's, in my view, it's for those instances where you're inside. If you're going to Market Basket and you're standing in line, you're going to need that mask once you get to the door anyway, so you should have it with you, because otherwise, my expectation is the store is going to refuse service if you don't have that mask or that face covering. As far as the lines in the Willows over the weekend and businesses of that nature, we spoke to the business that was open, and we've worked with them to try and do something where they're going to do call ahead or order ahead online orders, and they'll do curbside delivery. We're talking with all the businesses in the Willows in particular as they get ready to open about doing the same thing. We're trying really to limit the number of people that are standing around in line. And if that were the case down there, then I would probably recommend to people that they do wear those masks as they're standing in line. So we're hoping going forward that we won't have those crowding issues that we had over this past weekend down the Willows. We do have a number of establishments that are getting ready to open up in the next week or so. We've addressed that with them in that stance. So we're hoping that they'll go in that direction. And if they don't, we'll address that with them again and push them in that way.
I just point out under the order, it does say if you're picking up takeout food, you need to have a mask on. So technically,
Yep.
even small eateries down there should be requiring a mask. But the real goal is not to have a line like that. And, there is a technology solve for that in terms of calling ahead and ordering ahead. And the owners of the businesses in the Willows, I think, have been very cooperative and understand, that there's another way to do it. Fair to say, Dave?
Yeah, absolutely. Yep.
Yeah, I would just question also on those spaces, is that at what point is it considered a gathering of over X number of people? If it's outdoor and they're by their own free will standing in line there, is this something that the city should be enforcing going forward, or is it? I guess what should residents know about whether that's okay or not okay moving forward?
I think that the residents should know that we're not looking for lines in the Willows in particular, because that's where they are. But any business like that, I know we have Dairy Witch out on Boston Street, and we have Captain Dusty's on Derby Street. We'll be talking with them as they get ready to open to eliminate those lines through, call ahead. And if you can't do call ahead for an ice cream cone, then maybe you sell pints or quarts of ice cream instead, and people can call and get that. It'll be ready when they get there. We will work to enforce those types of, I don't want to call them orders of regulation, but those specific types of controls on businesses, offering that type of service, so that we do not have that happening, at least for the next several weeks. And then, as we evaluate going forward, we'll have to determine if it's something we need to take more stringent action on. It sounds like, based upon the conversations that me and my staff have had, that everybody is willing to comply with that and, eliminate those lines down there.
And then one other question on, I had a resident reach out to me today questioning construction crews and what she was seeing with, I guess, not obeying some of the social distancing guidelines that we've put forward, spitting, throwing their cigarettes out, just issues like that people see as a little bit concerning. Is there a method, or is there a discussion of the city having some kind of a method of syncing up with those crews that likely don't live locally here, may not understand what our local guidelines are here in Salem?
My understanding is that all construction projects in the city have been informed of what our guidelines are, and it's incumbent upon those foremen and general contractors to make sure that their crews are doing that. I know the building inspector is sending people out periodically to spot check, and we are responding to complaints. If he needs assistance from the health department, when my staff is in the office, we'll certainly work with him to get those spot checks done or follow up on a complaint and make sure that they're complying with that. I did get your email. I apologize. I didn't get to respond earlier today, but if you send us that information, I'm sure either Tom St. Pierre or somebody from his office will get out there and address that with them directly. Honestly, the thing that I'm really upset about with that is that I don't like them spitting on the ground. We know this is spread through saliva, so that's extremely frustrating to me.
Can I just build off that for 1 second, Counselor? We're taking the additional guidelines that were issued by the state very seriously. And I know Tom, his team, and some of Dave and his members, we have visited many sites. We have gone through this. Some are, going beyond what those guidelines require to comply. Some jobs have just shut down or really diminished. Others are still working and are supposed to be complying. And if they're not, the building inspector can shut them down. So definitely, if you're seeing inappropriate behavior or not in compliance with the guidelines, please let us know. We also have work going on ourselves as a community. We're trying to take care of a lot of the particularly exterior paving, sidewalk work in the downtown and places where it's hard to do that when there's a lot of people out. So we're mindful, our own contractors are mindful and have that guidance as well. So I have a husband who works in construction. We take it seriously. So if you're seeing something or residents are seeing something, please let us know. You can reach out to Tom St. Pierre, tstpierre@salem.com. And certainly myself, mayor@salem.com, and we will make sure we're visiting those sites and taking this whatever actions necessary.
Thank you. Thank you, Mr. President.
You're welcome. Council Flynn.
Thank you, Mr. President. I've had some people reaching out to me about the setup up at Salem High School, the field house shelter in place. Has any other community reached out to Salem to send people to our city? I know we're helping out with Beverly. Has any other communities reached out, cities or towns around that want to also Salem High Field House?
Yeah, sure. We actually didn't get a chance to give the update with respect to any of those other issues. So let me take just a brief second to make sure folks are aware. I know you are, Counselor, and the other members are as well, that in working with our public safety team led by Chief Butler and also Chief Ginto playing a large role, we've been working to try and identify a quarantine site for a homeless population. As folks know, we do have a homeless shelter here at LifeBridge. They have 50 beds for men and women at the shelter. LifeBridge also operates the River House in Beverly, another shelter, smaller size, about 30 men only at that facility. We've also worked cooperatively with Lynn. We do not share a shelter operator. They have a separate shelter that operates in Lynn. I think that's about 50 beds as well. And the three communities have been collaborating on where we could locate a quarantine site. We know that the homeless population is at a higher risk for catching COVID, and they are at a lower opportunity to safely quarantine or even practice social distancing, given some of the limitations in the way shelter space is laid out in all of our communities. The real key is trying to make sure if folks have been exposed to somebody close or in close contact with somebody who tested positive, for them to be able to self-quarantine for 14 days and not be in proximity to other people. And that's the hardship we were trying to solve for. Anybody who is tested positive for COVID, the state is working to set up what they call isolation centers. So if you're tested positive, hopefully not sick enough where you need to be in the hospital, where would you self-quarantine, self-isolate in this instance, and be monitored so that your condition can be monitored by medical professional, et cetera. They're taking that caseload on. The state is. They've got an isolation center in Lexington is the closest one, and there's a couple more in I think Central Mass and out in Pittsfield. They're also looking to locate more somewhere in the Northeast and Greater Boston region. For individuals who are not positive but who do need to quarantine because they may be positive and they're asymptomatic, and they just need to be able to not be close to other residents in the shelter. The high school at Salem High School, the field house there was identified as a site. And I know the chief has gone through with you and others the process that was used in looking at numerous sites. And we were, I think, pretty close to working with St. James on their basement site. Father Murray there was supportive and open, but they didn't have showers there. And if you think about having to quarantine for 14 days, showers and bathroom is a real necessity, bathroom amenities. So the quarantine site right now at the high school is being stood up, should be operational, we hope, by tomorrow. That's the date. We were actually targeting today, and it slipped a little bit because we're working on ensuring the adequate staff is there. But it will be, it is expected Friday, Saturday at the latest to be up and running. And it will service homeless individuals who need to quarantine from Salem, Beverly, and Lynn. We have been in touch with Peabody. They have not indicated that they want to participate, but they certainly have a homeless population as well. There's been some outreach from Gloucester. Gloucester has a shelter not operated by LifeBridge. LifeBridge does operate a day program there. At this point, we're only talking about our 3 communities because we haven't even got this thing operational yet. And so we want to be careful about biting off more than anybody can chew. And also at the same time, there's a great sense of urgency in making sure that we have this space set up. The worst thing we could do, certainly it's a vulnerable population and we're trying to watch out for all of our vulnerable populations, but the worst thing we could do is not have any site, and these members could be exposing other members of our community to COVID. So at this point, it's just those 3 communities, Counselor, but I think there might be interest in others, and
Yeah.
remains to be seen.
Well, that's great. I just want to make sure that other communities, when you start going up to the Gloucester area, or even further north, south, or west, that they would be willing to set up high schools in their area too, just so everyone isn't shipped to Salem. To be a burden on the high school and our public safety and stuff like that. My other question was there any discussion with Beverly or Lynn as far as providing any services to help out, maybe police services, so it's not all burden on the Salem police, since everyone's got to help and do their share?
Yeah, the 3 communities have been working together. I think it's fair to say Salem's taken the lead, given that it's in our community, and we have a good relationship with LifeBridge and the work that they're doing there. But the expectation is this cannot operate with just one city. And frankly, the reason this really needs to be regional is just the lack of resources, staffing resources, financial resources, and frankly, no one community, has enough of a need that we would need something the size or scale, but the costs are still the same, right? If we were trying to stand up a quarantine shelter, it would cost us the same, whether it was just in Salem or Salem, Beverly, and Peabody together. So what we're trying to do is ensure that we have something that's operational that can be adequately staffed. And there's just no way 3 communities, 3 different staff. The shelters themselves their staff, many of whom are older, many of whom are they have a lot of volunteer staff, just aren't able to help out as much. Their financial resources have really been hit here in LifeBridge. They rely on the thrift shop on Canal Street for a hefty percentage of their revenues. That thrift shop brings in around $10,000 a week for LifeBridge, and it's currently closed. So just the finite resources of people and money to operate something like this, it's incumbent upon us to kind of work together. So all 3 communities are sharing in the costs. We hope and expect, and everything from MEMA and DPH is that this is something that's also reimbursable under the federal disaster guidelines. But there will be cost, and we think it's only fair that we all bear them together, and that's the expectation from the other leaders of those communities as well. Mike Cahill and Tom McGee have been, part of this effort from get-go.
Okay, all right, thank you.
Yep.
Councilor Dominguez, then Councilor Prosnowski.
Thank you, Mr. President. As many of you know, I've been hit by this virus very close. My aunt passed away in New York. One of my brother was admitted in the hospital. My uncle is in the hospital right now. And one of the things that we hear in the news is about ventilators, saving life. I think that ultimately, that's what we all agree that we need to be focusing on. And my questions related to that is, and I hear in the national news how difficult it is for the state, cities, and towns to get the ventilators. For the peace of mind, for the residents of Salem, and for my own peace of mind and my family peace of mind here, do you know how many ventilators do we have here in Salem available? And also, seen in the news that one of the communities that is the most hit one is the Latino and the African Americans. The hospital is provided with some type of translation available for those type of emergency, making sure that when we see the high right number, like unfortunately it's happened here in Salem, we had the availability to save some life.
I actually don't have an update this week from Dr. Roberts. I did speak with him last week, and we typically try and connect on Fridays. But I know that they are part of the partner system, so that's to our benefit right now, because they do have access to a larger supply of equipment. They're not the only ones sourcing these materials, so that is that's a plus. I will also say they are busy. I mean, the ICU unit there would normally have 6 to 8 patients in it, and when I spoke with him last week, I think we were in the 50s in terms of individuals in the ICU and needing vents. So he's working harder than anybody I know, trying to make sure that not only Salem, but this region has an adequate supply of ventilators, and is looking to source those from as many places as possible. They have expanded the ICU several times into different floors and different areas to accommodate the surge. And I think Partners has access to some of the best epidemiologists and modeling, and is really watching this thing closely. They've been at the epicenter of all of the planning efforts, all of the real demands to get more PPE here, to the sanitizing machine from Victel that can sanitize and reuse N95 masks that's set up in Somerville. They were a lead partner on that effort. So we've got just a terrific healthcare institution, along with an amazing supply of dedicated personnel. I mean, the North Shore Medical Center, Salem Hospital, for many of us who've been here long enough to know it as that name, are second to none. People are, redeploying. They're not doing elective surgery. So OR nurses that used to be in surgery are now helping out with ICU. They've set up teams of people so that they can have folks who are trained or trained up to take on the additional caseload that they have. I think it is very demanding. I think it is really taxing them on all fronts, but I know how hard they're working to try and keep up with it. And having that access to other partners' hospitals, I think is a plus for us, generally speaking. They're not left out on their own to sort of fend for themselves. I'll get more of an update tomorrow. I think they are busier than they've ever been in that hospital's history. They've never had, 50 people on ventilator machines at one time, for sure. I mean, in our conversation last week, Dr. Roberts, was very clear about that. But I also know how hard they're planning and sourcing and thinking through plan A, B, C, D scenarios to try and make sure they have enough of everything, not only ventilators, but staff. That's really critical. If we have a run of staff who end up with COVID, if there's a large percentage of people that aren't able to work, that's of concern for sure. So I can provide you with a better update after I speak with them tomorrow. But I feel super confident in Dr. Roberts' commitment, dedication, and capacity to do as much as he possibly can. And he's been at Salem Hospital since it was Salem Hospital. He's not somebody who's a CEO. He is a physician first, a CEO second, and is well known in the organization.
You all set, Counselor? Counselor Prezinski.
Thank you, Mr. President. I'll throw you to the mayor. Mayor, I know that the city has put aside $250,000 to as funding just for this issue, and I'm not sure where we are with that. Do you feel that it's going to be adequate? And to add to that question would also be: are we looking at any state or financial aid coming to us soon, or federal aid, actually?
Yeah. So we thank you for that question, Counselor, and thank you for the counselors for the support of funding. We have used some of the funding so far to help us with food needs, so supporting Root with delivery of senior meals, the expansion of sort of that Meals on Wheels program concept. Citizens In, who works to provide meals. 50% of their folks, they're just over the line in Peabody, but 50% of their clientele come from Salem. And we have a request in from the Salem Pantry, who I think many folks know is really surged in what they're delivering to the food sites where we do grab and go lunches, pantry items there. So we expect to be able to fulfill that request. So far, most of the resources that we've expended have gone around food. We have an order in for additional PPE equipment. That bill hasn't come in yet, but some of those dollars will go for that as well. In terms of reimbursements, so you might remember this, Counselor, from your days on the force, the deal with federal disaster reimbursement dollars under MEMA or FEMA is that you spend the money and then you get reimbursed for 75% of it. And usually you get reimbursed like 18 months later. And, after a lot of tracking, a lot of I dotting, T crossing, resubmitting information, we are told this time from FEMA folks that they are going to be reimbursing communities, particularly around some of the homeless outreach work, on more of a rolling basis, so that it wouldn't be like you're waiting, a year and a half down the road to get it and they put you through hell, trying to get the reimbursement. So we're hopeful that we're tracking all of our expenditures. Chief Jinta in the fire department is our MEMA coordinator, and we have these MEMA worksheets, and that's where departments are tracking any expenditures tied to the COVID response. And those are the dollars that we hope 75% of them will be reimbursed. I don't have a tally as to what it is at the current moment, but do know that we're tracking it closely and hope and expect that we'll be able to be reimbursed at that 75% rate. I do think we're going to have costs that will incur beyond that. And, I don't know exactly what that outlay will look like, but certainly we're trying to work through not only expenses, but, where we are from a revenue projection side. The last quarter of many of our key revenues, from meals taxes to hotel taxes, cannabis revenue is a new one for us, but certainly one that was coming in strong. Those are all likely to be, next to nothing. Even parking revenues, we're not enforcing any parking rules or anything like that this quarter. So we're gonna be down some revenues this fiscal year. So we're doing those projections now, and we're trying to sort through all of it. But I do think we're going to have extra costs, not just dealing with the response to COVID, but on the recovery as well. We're really giving some thought to what the new normal might look like and how we can make sure we don't have a lot of dark windows downtown and in our business community throughout Salem. I think that's really critical. Once you lose a business, it's especially in this environment, it will be months for a transition to take place. So to the extent that we can do things to keep our business community healthy, the business community we have here, we really need to double down and take those steps. So more to come on that front for sure. And if there aren't questions, I would want to just give you a couple of other updates. I think that are things that are timely and of interest. If I could briefly, Councilor McCarthy, would that be okay?
Yep. No
So
problem. Go ahead, Mayor.
we've talked about the homeless quarantine site at the high school, a temporary shelter, I should say, there. I also wanted folks to know that we're really trying to work hard to find apartments for homeless families. I think all of you on the call, and maybe many folks at home who might be listening along, know that we do have and have had an affordable housing issue in our community pre-COVID. And we've got anywhere from 80 families at any given time right now. That's about that number, who are homeless or in a shelter or double or tripled up. We're working with Salem State to identify some unused dorms, particularly the Bates apartment complex dorms, to repurpose them for some of the families who currently are either living in motels or, as I said, tripled up and really not in great circumstances. If you're thinking about being home all day, children, young families, small rooms, or really crowded circumstances, and not really safe from a health perspective either. So we're really fortunate. Salem State's been a terrific partner. We've got 4 families that we expect will be moving in this weekend into the Bates complex. We're hoping that we can free up some additional units there. The apartment style units are sort of the right suite style in terms of rooms and bathrooms. They're nothing glamorous by any means, but they are, have the space and accommodations. They have small kitchens in them that could serve a family well. So I just wanted to flag that for counselors, that we're grateful to be able to place folks. We're also trying to reach out to any landlords in our community or landlords who own property in Salem who may live in other communities. If they have a vacant unit we really could use it and put it into good use for the next 3 to 4 months or longer if they'd be willing. And most of these families have vouchers. They just can't find units. And if we are going to reach out to folks who have indicated via the trash fee payments that they have a vacant unit to see if we can put it into service for them or work with them to try and find better accommodations for families that are currently really up against it. Again, many of whom have resources to pay rent, but just have had no luck finding a unit. Just the last couple of things I would mention, we did post on the city website the fact that we're deferring payment due dates for real estate taxes, for excise taxes. So we'd ask that you please share that. We're also really working hard on this renter relief and small business relief program. We know that we'll have some additional dollars coming in from the federal government for our community development block grant funds. There's a couple of hiccups to use it, or I should say hurdles to use it, but we are hopeful that those are resources that can support the typical type of CDBG efforts, be they social service programs, economic development, housing supports. So stay tuned, definitely more coming on that as we unpack what's available. We had an interesting call today with members of the business community. We have a call with sort of our large employer group who shared with us sort of two different experiences. One of the 3P program, Payment Protection Program by the federal government, which if you keep employees on, the federal government will basically reimburse you for those costs, or perhaps a portion of those costs. There were businesses who had a really positive experience applying for that, worked with their local bank, particularly some of the smaller banks, not think the big corporate Bank of Americas, that they were able to get through, get things filed, feel really good about their application materials all being complete. And we had businesses who had a really horrible experience and couldn't get through and didn't have the information or couldn't get the information to comport with what the requirements were. So we're trying to unpack that a little bit more. The idea would be if there's some gaps that we could help out with, because we don't have big dollars. And the other piece of that might be of interest is folks aren't really sure how much they're going to be entitled to receive. So the program certainly on its face looks fantastic in terms of helping people who really need it now, and most importantly, keeping people employed. But I think one of the folks from Salem 5 was on the call today and said, like, Bank of America had like $800 billion worth of requests, some of these big banks. And the whole relief program is in the 400 range. So it remains to be seen how helpful it's going to be. And we're going to keep tracking that. Again, gaps, where can we fill in? How can we make sure that when we're past the point of having to practice social distancing, whenever that is, we can still have a healthy community and healthy business community to go back to. So I'll pause there, and I'm happy to answer any more questions or let you guys go on with your business, whatever works for the group.
Anyone else? Council Sergeant up in the corner. Or my corner.
All right, thank you. Question for Dave. Are the positive test cases in Salem based on test results? Is there a way to confirm when they recover? And when they recover, are they taken off the list of virus cases in Salem? Thank you.
So yeah, all cases that we report out are test confirmed cases. I'm going to qualify that with saying I do believe that the positive cases in Salem is probably a little bit inaccurate because people are being clinically diagnosed without getting a test. But we are only reporting those results that we get a test result for. We do know that people recover from it. It's been a little bit challenging just tracing that back because of the influx of cases, where our priority is really dealing with that initial case contact and contact tracing. So we're working on that right now. I am looking to get a student to come in who is working with the city of Peabody to do some data analysis, and hopefully, if we can do that, we'll be able to get some better idea of what's happening with recoveries. We're still also trying to determine what the immunity is after somebody's had COVID-19. We're finding that it's happening. We're having multiple positive cases in a single address. So we're concerned that if we release someone from isolation to quarantine, they could get reinfected because we're not positive of what that immunity is. So we're taking our time a little bit just to make sure that when we do report recoveries, they've actually recovered.
You all set, Council?
Oh, say I'm muted.
You're muted now. You all set, Council Sergeant? Anything else?
I'll second.
No? Okay. Anyone else?
I'll second.
All right. I guess Councilor Dibble.
Thank you, Mr. President. Dave, this is wonderful news. Thank you for being so proactive with the face covering requirement. In reading the ordinance or the order rather, just want to point out that reusable supermarket shopping bags are not allowed to be brought back into the stores. So leave them in the car. Save yourself a little aggravation of going through the line, carrying them, and then bring them all the way back to your car. It's a small deal. The masks are key. I'm going to talk about masks more a little bit later. And in terms of finding the order, it's buried on the city's website under the health department. So it should be put out front under the code red section, perhaps, Mayor, so it's more readily available. And I could not find the simple outline. Rather than giving people the entire document, it would be great to have just that outline as we talked about earlier. So please send that out immediately, and I will send it out to almost 500 families tonight in Ward 7. Thank you, Mayor and Dave.
Council, I'm just going to request that you refer to them as face coverings and not masks. We really want to try and push people to those cloth type coverings, not the surgical or the N95.
Agreed. We have volunteers in Ward 7 making cloth ones. I'll just demonstrate it now, but I'll talk about it more.
All right. Anyone else?
Perfect.
Seeing no one else, I just want to thank the mayor and David. David, I know I'll see you tomorrow like I have seen you every day for the last, I don't know, a couple of weeks, and you need some sleep, buddy. You go home and get some sleep, and we'll see you bright and early tomorrow. And for everyone on this screen and everyone watching at home, I can't tell you how highly, I mean, we as councilors are part of the city council. We don't get, we don't deal with the administrative side. And because of this situation, I've been allowed to participate in the daily conference calls to make sure that any questions that come up relative to the day-to-day stuff, we get that information out so any one of you on the screen can reach out to me and I can let you know what's going on. I can't speak highly enough for all the personnel in the city of Salem and what they're doing day to day, even hour by hour, on our behalf and on the behalf of the residents at home, to try to, make everyone aware of what's going on, try to safeguard everyone as best they can. And Chief Junta every day reminds everyone about filling out those sheets. And I don't get a sheet, so, but it's important that, we're tracking this. We're doing we can, but I will say that Dave and his staff, and Dave's brought over some personnel from actually the school department, some of the nurses that are doing some of this tracking that, once someone's tested positive, it's important to find out where they've been, who they've been with, so we can, reach out to them and get them to self-quarantine so this doesn't spread. And so the work that they're doing on a day-to-day basis is phenomenal. And I could go on at length, but I won't. But just, David, get some sleep, and I'll see you tomorrow. And thank you, Mayor, and thank you, Tom.
Thanks,
Thank
everyone. Thanks.
All right, back to the regular portion of the meeting. Before we do that, Council Dibble has asked for a moment of personal privilege. Council Dibble.
Thank you, Mr. President. I'd just like to recognize, without pointing out the names, that we have about 11 volunteers scattered all around Ward 7 that are making masks. They've already made 2,000 masks that were made and delivered to Salem Police, Salem Fire, ambulance companies here in Salem, but also to other cities and towns on the North Shore. They provided just over 2,000. It was originally 1,500, and then several, including Salem Police, had requested more masks. So they've been very busy. They did have a very large pile that was surplus that they had made, and they offered it up to me to distribute to their neighbors throughout Ward 7, and we've done that. You probably have seen it posted on Facebook. I've emailed Ward 7, and we've delivered them, and we're only giving one mask per household purposely so that we can distribute the mask to a wider audience, if you would, throughout the whole city, but also not to encourage not to develop a false sense of security with these masks. We don't want whole families going out to the supermarket together. We'd rather have just one person from a family or from a household go shopping and hopefully just stay home and not shop until it's really needed to go shopping. So with that, I'd like to demonstrate the masks that they're making. They're 100% cotton. They're double thick. They're pleated. They have elastics on the end, and they simply go over your nose and your mouth. They're quite comfortable, and they last a long time. This one here has been washed, I think, 5 times now. Needs to go in the wash tonight. I wash them with our regular laundry in the dryer as well. Probably get 50 or more washes out of it at your house. We've done an incredible number of deliveries all over the ward, a little bit to Ward 5, a little bit to Ward 4. The mask makers are doing a great job. We're now at the point that we want to open up to all of Salem. So if anybody's out there listening, including you counselors that need a mask, we're going to give one per household. You can simply email me your name, address, and telephone number to sdibble@salem.com, and we will deliver a mask to your house here in Salem.
Thank you, Counselor. Anyone else? Seeing none. We'll go back to the regular portion of the meeting. Hearings, none. Go ahead, Madam City Clerk.
Appointments, reappointments. The mayor's reappointment of Rebecca Christie of 17 Marlborough Road to the Commission on Disabilities for a term to expire April 13th, 2023.
Counsel Flynn.
Thank you, Mr. President. I'd like confirmation by a roll call vote.
Counsel Flynn moves for confirmation by roll call vote. Seeing no objection, Madam City Clerk, will you call the roll, please?
Councilor Dibble,
Yes.
Councilor Dominguez,
Yes.
Councilor Flynn,
Yes.
Councilor Hapworth,
Yes.
Councilor Madore,
Yes.
Councilor Marcillo,
Yes.
Councilor Prosnewski,
Yes.
Councilor Riccardi,
Yes.
Councilor Sargent. Unmute, Councilor Sargent.
Counsel Sergeant.
Yes.
Thank you.
Councilor Torrio,
Yes.
and Councilor McCarthy.
Yes. On the matter of the reappointment of Rebecca Christie to the Commission on Disabilities for a term to expire April 13, 2030, although we have 11 members voting, 11 in the affirmative, none in the negative, the matter carries.
Communications from the mayor.
Communications from the mayor.
We have an order that the sum of $20,000 is hereby appropriated and transferred from capital outlay to the short-term CIP Health Mac Park Farm Project account for the construction of a split farm fence, French drain, and irrigation pond.
Counsel Terrio.
Thank you, Mr. President. I move for suspension of the rules.
Counsel Terrio moves for suspension of the rules. Seeing no objection. Counsel Terrio.
Thank you, Mr. President. I move for approval.
Counsel Terrio moves for approval. Under discussion, Counsel Terrio.
Yeah, thank you, Mr. President. This is a initiative that Carrie Murphy's been working on with the Board of Health and a number of other people throughout the city. They're going to be building a small-scale farm at Mac Park and using that to teach people skills and also to grow some food supply for some of our city, some of our needs in the city for people who have food insecurity. So it's a wonderful program they've been doing. It's kind of an expansion on what's been going on down over at Forest River Park for the last few years. And, or not Forest River, sorry, at Palmer's Cove Park. And I think it's a terrific addition.
Thank you. Any further discussion? Seeing none, I will say that she reached out to me today and we had a nice brief conversation. And I think it's very, and today, with everything that's going on in the world today, the ability to teach people how to grow food and actually grow food on our own and then provide it to people is, I think, very important. So seeing no objections, no further discussion on Council Terrio's motion for adoption, all those in favor? Raise your hand so I can see them. There you go. All in favor? Matter passes. Further communications from the mayor.
We have an order that the sum of $10,931.06 is hereby transferred from City Council advertising account to the elections overtime account and the elections part-time salary account as provided below.
Council Terrell.
Thank you, Mr. President. I also move for suspension of the rules. Oh, and just a quick note. We should, because when we do a hand vote, you should probably call out the count as you see it. Just
Yes,
to make
sir.
sure people,
Yep.
because they can't follow it in person.
Okay.
So I know you can see us all, but that should probably be done. So that said, I move for a suspension of the rules.
Council Terrell moves for suspension of the rules, seeing no objection. Council Terrell.
Thank you, Mr. President. I move for adoption.
Council Terrell moves for adoption. Under discussion, Council Terrell.
Thank you, Mr. President. This is for our city clerk to cover costs of early voting and the money that's been spent on the presidential primary. So I know I've discussed this with our city clerk, as have you, and and I believe she's discussed it with some of our colleagues. And this is money we need to run elections in the city, and I see no issue.
Thank you. Any further discussion? Seeing none, on Council Terrell's motion for adoption, all those in favor? Council Dominguez, there you go. That'd be 11 in the affirmative, none in the negative, so the matter carries. Further communications from the mayor.
We have an order that the sum of $8,090 is hereby transferred and appropriated from free cash to the general fund election poll worker accounts to cover the cost of poll workers for the March 3rd presidential primary election.
Council Terrell.
Thank you, Mr. President. I also move for suspension of the rules.
Council Terrell moves for suspension of the rules. Seeing no objection, Council Terrell.
Thank you, Mr. President. I move for adoption.
Council Terrell moves for adoption.
Just to briefly, this is also this is the remaining part of the transfer having to do with our, with our early voting on elections. And this is because of an increase in minimum wage as of January 1st, 2020, and to cover some of the other employees we've had to bring in for work on this. It's nice that our voting is starting to trend up in these, and early voting has been a tremendous success in getting more people out and participating, but we do have additional costs with that.
Yes, we do.
I think getting more people participating in voting is absolutely worth it, though.
Yep. Any further discussion? Seeing none, Councilor Terrell's motion for adoption, all those in favor? All those opposed? None opposed? The matter carries. It was 11 hands for that one, if anyone is curious. Mayor's informational page.
None.
Councilor Riccardi.
Motions, orders, and resolutions.
City of Salem and City Council, April 9th, 2020, ordered the Salem City Council, consistent with an order of the Salem Cemetery Commission adopted on April 6, 2020, hereby adopt the name of F. Carroll Sargent Arboretum at Green Lawn Cemetery in reference to the historical collection of tree species for the process of establishing an arboretum at Green Lawn Cemetery. And I move for adoption.
Councilor Riccardi moves for adoption. Under discussion, Councilor Riccardi.
Thank you, Mr. President. The order on the agenda was slightly revised after it was posted, so I'm asking for adoption as amended. The original order states that we're establishing an arboretum at Green Lawn Cemetery. We're actually not doing that. We're just adopting the name of hopefully a future arboretum, and this name will be used in an application to the organization that grants the official arboretum status. The adoption of this name will be forwarded to ARB-NET, which is the collaborative of community arboreta for the official accreditation. The F. Carroll Sargent Arboretum at Green Lawn Cemetery. This accreditation will give us access, or give them access to knowledge and expertise and grants and other resources to further the improvements at Green Lawn. I think a lot of us have been spending more time over at Green Lawn with being at home, and it really is a great and beautiful resting spot for many in the city of Salem, and it's also a beautiful spot in the neighborhood. So with this huge collection of trees there, that we'd like to honor F. Carroll Sargent, who really helped initiate getting those there. I think the naming is quite appropriate. I'd like to take a quick second to thank Bob LeBlanc, who's the current cemetery superintendent, to help keeping this move forward, and tree warden, as well as the groups that are working to get this accreditation, like Friends of Green Lawn, Christine Lutz and Pat Donahue. We're also working with Salem State University and Dr. Lisa Delicio and her students there. That's it.
Thank you.
Thanks.
Any further discussion? Seeing none. On Councilor Riccardi's motion for adoption, all those in favor? All those opposed? Matter carries 11-0. Further motions, orders, and resolutions. Councilor Terrio.
Thank you, Mr. President. City of Salem, year 2020, ordinance to amend an ordinance relative to traffic, section 42, section 57A, parking time limited, unmetered, and section 13, service zones. Be it ordained by the City Council of the City of Salem as follows. Section 1, section 57A, parking time limited, unmetered zones. Article 5 be amended by repealing the following. Washington Street, parking time limited, unmetered, southwest side, beginning at 2:48 and continuing to 2:64. 2-hour parking, Monday through Saturday, 8 a.m. to 6 p.m. Section 2, section 13, service zones of Division 2 of Article 5 be amended by repealing the following. Washington Street service zones in front of 264 Washington for a distance of 40 feet service zone, Monday through Saturday, 9 a.m. to 5 p.m. Washington Street service zones in front of 264 eastbound for a distance of 40 feet, no parking service zone. Washington Street service zones beginning 60 feet from the intersection of Pond Street and Washington Street westerly side and running south for a distance of 60 feet. And Washington Street service zones on the southwesterly side of Washington Street for a distance of 15 feet, extending from point 20 feet southeasterly of Pond Street. Section 3, this ordinance shall take effect as provided by city charter, and I move for adoption for first passage.
Under discussion, Councilor Terrio.
Thank you, Mr. President. This came from the Traffic and Parking Commission and Lieutenant Tucker. This has been a situation where the businesses and around Lafayette Park have been looking to try and make sense of what have been a lot of contradictory regulations for that. We've had ordinances that were posted that conflicted with existing ordinances and inconsistent zones. And so the commission and the lieutenant worked this out with the neighbors there and came up with this to normalize parking in the area. So everybody's on board, and this just makes it consistent to the underlying regulations for the entire strip.
Thank you. Any further discussion on this matter? Councilor Dibble.
Thank you, Mr. President. If I can just ask the Ward 5 counselor, through you, are there any deleted ordinances? You said that there's a lot of confusion with different ordinances there, but I don't see that we're deleting any of the existing ordinances to go forward with this good ordinance. Thank you.
These are all repeals. All set, I believe, Mr. President.
You're all set? You all set, Councilor Dibble? All right. Seeing no further discussion on the matter, on Councilor Terrio's motion for adoption for first passage, all those in favor? All those opposed? Matter carries 11-0. Further motions, orders, resolutions. Councilor Hapworth.
In the year 2020, an ordinance to amend an ordinance relative to traffic bus stops. Be it ordained by the City Council in the City of Salem as follows. And if anyone wants to waive the reading, good.
So moved.
Move for adoption for first passage.
Councilor, let's go to the page. Councilor Hapworth moves for adoption.
Under discussion?
Is it under discussion?
Under discussion.
Bob froze up, sorry. Or Councilor McCarthy froze up. I believe this is a recommendation from Destination Salem and the Traffic and Parking Commission to sort of maximize some of the space regarding tour buses and vehicular traffic. Some of the spaces, particularly I think around the Common and the Visitor Center.
Thank you. Any further discussion? Seeing none on Counselor Hapworth's motion for adoption for first passage, all those in favor? All those opposed? The matter carries, 11 to none. Anyone have a motion or a resolution to bring in? Nope, thank you. Committee reports. Councilor Terrell.
Thank you, Mr. President. City of Salem City Council, April 9, 2020. The Committee on Administration and Finance co-posted the Committee of the Whole, to whom was referred a bond order for $1,565,000 to replace the boiler system at the Bentley Academy, has considered said matter and would recommend approval for second passage by roll call vote.
On acceptance of the report, all those in favor? All those opposed? On adoption of the recommendation, under discussion, Councilor Terrell.
Thank you, Mr. President. Briefly, we had a committee meeting tonight at 6 o'clock before the city council meeting. A couple of things that came out was that the boilers themselves, there's 2 boilers in the system. It's end of life. They are both end of life and failing, the approximately 20 plus years old. The total cost and loss to the city is $433,000. The remainder of the money is being reimbursed by the Mass School Building Authority. Replacing this entire boiler plant does not preclude doing further efficiencies downstream, but the School Building Authority does not cover those improvements. And that's pretty much the bulk of it. These will be high efficiency gas-fired boilers, replacing the existing system, that's the existing gas boilers that are in place. So it will increase efficiency, although it is not as completely green as some would hope for. It is still an improvement over what is there before, and they are going to evaluate going forward with this and other schools, opportunities to improve efficiency and save energy as they go forward.
Thank you. Any further discussion? Seeing none. Madam City Clerk, will you please call the roll?
Counselor Dibble,
Yes.
Counselor Dominguez,
Yes.
Counselor Flynn,
Yes.
Counselor
Yes.
Counselor Madore,
Yes.
Counselor Marcillo,
Yes.
Counselor Prosnewski,
Yes.
Counselor Riccardi,
Yes.
Counselor Sargent,
Yes.
Counselor Torrio,
Yes.
and Counselor McCarthy.
Yes. On the matter of the second and final passage of a bond order in the amount of $1,565,000 to replace the boiler system at the Bentley Academy, we have 11 members voting, 11 in the affirmative, none in the negative. Matter carries. Further communications from city officials, none. Petitions.
We have a petition from Comcast to install a conduit at 155 Essex Street.
Hearing ordered April 23rd, 2020. Further petitions.
We have petition from National Grid and Verizon to install 2 jointly owned poles, one on Ferry Street and one on Waite Street.
Hearing ordered April 23rd, 2020. Further petitions.
We have 6 petitions from Verizon to attach a small cell wireless antenna on the following streets: 201 Derby, 389 Lafayette, 8 Loring Ave, 198 Loring Ave, 28 Raymond Road, and 13 Washington Square.
Thank you. Hearing ordered April 23rd, 2020. Further petitions.
We have 1 Tag Day license application.
Councilor Madore.
Thank you, Mr. President. I move that this be referred to the Committee on Ordinances, License, Legal Affairs.
Councilor Madore moves that this matter be referred to the Committee on License, Orders, and Legal Affairs. Any further discussion? Seeing none, on Councilor Madore's motion that this matter be referred, all those in favor? All those opposed? Matter carries 11 to none. It's by my count. Unfinished business.
We have a second passage of an ordinance amending traffic chapter 42, section 88, speed zone regulations for Valley Street.
Councilor Flynn.
Thank you, Mr. President. Move for adoption for second and final passage.
Councilor Flynn moves for adoption for second final passage. Any further discussion? Councilor Flynn? Seeing none?
I just want to echo what I said at our last meeting. Some people were under the understanding that the speed limit was actually going up on Valley Street, and that's not true. What's going on here now, that I got this from Lieutenant Tucker and Dave Kuchowski from traffic. And what the issue is here is that the beginning section and the end section of Valley Street is 25 miles an hour. The center section, the way it is by the DOT, it was agreed upon, is 35 miles an hour right now. For some reason, it wasn't signed correctly for a while. So when this was looked into, they petitioned the DOT to try to get it down lower. And the best they could do is get that center section down to 30 miles an hour. So in essence, what's really happening here is that the center section of Valley Street is actually going down. Some people think it's going up, like I said, because you see those 25 mile an hours at the beginning and at the end. They're going to see a 30 mile an hour now in the middle. When this was petitioned to try to get it as low as possible, I was told that the DOT has standards that they go by in calculations in the neighborhoods, and that was the best that they could come down to was 30 in the center. That's what this is all about. It's actually going from what it's supposed to be at 35. It's always been down to 30 miles an hour in the center part of Valley. That's all I have on that, Mr. President, as it was explained to me.
Thank you. Any further discussion? Seeing none, on Councilor Flynn's motion for adoption for second and final passage, all those in favor? All those opposed? Matter carries 11 to none. Further unfinished business.
We have a second passage for a traffic ordinance, chapter 42, section 49, stop sign on Osborne Street.
But this is my favorite.
Councilor Riccardi.
Thank you. I move for adoption for second and final passage.
Councilor Riccardi moves for adoption for second and final passage. Under discussion?
No discussion.
No discussion on Councilor Riccardi's motion for adoption for second and final passage. All those in favor? All those opposed? Matter carries. Saw 11 hands. Further unfinished business.
We have a second passage of an ordinance, chapter 42 for traffic, section 49, stop sign for Walter Street.
Councilor Riccardi. I lost Councilor Riccardi for a second. Is she coming back?
Looks like she might have lost connection.
I'll do it.
Oh, sorry, I'm still here. I move for adoption for second and final passage.
Councilor Riccardi moves for adoption for second and final passage. Any under discussion?
No discussion.
No discussion. On Councilor Riccardi's motion for second and final passage, all those in favor? All those opposed? Matter carries. I saw 11 hands. Any further unfinished business? Seeing none. Any more? Oh, Councilor Flynn. Do you have your hand up?
Yes, I did. I just like a point of personal privilege.
Councilor
If I
Flynn.
can
Yep.
I just like to have a short moment of silence, if we could, for Councilor at Large Dominguez's aunt that passed away. For the worker, the young lady that passed away at Market Basket. I go to Market Basket all the time, and I do know the young lady's very nice lady, and I feel terrible about this. And also to add into that, for all the people worldwide that have been lost to the COVID-19, if we could just have a brief moment of silence for them and to remember them and for what everyone has lost.
Councilor Flynn has moved for a brief moment of silence. Thank you.
Thank you.
And I will just add before I recognize Council Sergeant, in this religious season that whichever faith you is yours, and as we come towards Passover and Easter, and just want to wish everyone out there a safe and happy holidays they celebrate in their own way, in their own homes. This
Hold on, Council.
You call him?
Council Sergeant.
No, thank you. I move for adjournment.
Council Sergeant moves for adjournment. All those in favor? All those opposed? We stand adjourned. Thank you.
Thank you.